Hi, happy morning, everyone. Welcome to Metier YouTube channel. I hope you're all fine and doing well for your upcoming exams. You all know that in Metier, we have started a new course sections for the next NORCET and upcoming nursing competitive exams. So we have 3 months course, 6 months course, and a 1 year allied program also. So who are willing to appear for exams, you can join the courses. Okay. And in the YouTube channel, we are posting a very important MCQs as well as some important topics for the nursing competitive exams. So today also we are going to see a important topic. Today not question, okay? Today we are going to only see the important topic which is related to our nursing competitive exam. So before starting the session, we'll start with a small quote. Stop being afraid of what could go wrong and think of what could go right, okay? என்ன தப்பா நடக்க போகுதுன்னு நினைக்காம என்ன ரைட்டா நடக்கலாம் அப்படின்னு பாசிட்டிவா திங்க் பண்ணீங்கன்னா உங்களால நல்லா பெர்ஃபார்ம் பண்ண முடியும். ஓகே, டோன்ட் திங்க் இன் அ நெகட்டிவ் வே, ஆல்வேஸ் திங்க் இன் அ பாசிட்டிவ் வே so that your performance will be better. Clear? Okay, we'll start today's session. Today we are going to see the cranial nerves. Okay, important topic. Okay, because cranial, we have, everybody knows that 12 pair of cranial nerves we have. Okay, so in some books they are showing that 13th cranial nerve also, that is not related to our nursing competitive. Okay, we have 12 pair of cranial nerves. So you all know that. For what are they? How can we remember? How can we make a mnemonics? Various types of mnemonics are there, which is better how I studied. So I'm going to show that slides. Okay, so the cranial nerves 12 pairs, starting with the olfactory nerve. Number 1, olfactory nerve. Number 2, optic. Number 3, oculomotor. Number 4, trochlear nerve. Number 5, trigeminal. Number 6, abduction nerve. Okay. Number 7, facial nerve. Number 8, vestibulocochlear nerve. Okay. And other names also there. In next slide, I will explain. Okay. And number 9, glossopharyngeal nerve. Number 10, vagus nerve. Number 11, accessory nerve. And number 12, hypoglossal nerve. Okay. Okay. 1 second. Okay. So we'll see how can we remember. Okay. How can we remember the cranial nerves? We'll see. So this is my mnemonics. If it is comfortable, you can take it. Otherwise, whichever it is comfortable for you to remember the cranial nerves, so you can go with that. Okay. So mnemonics for a cranial nerve: 111. 3-1 you can remember. 111, 2, 3, and 4. Very good, very acceptable hint. Okay, easily you can remember. So what are the 3-1? First is olfactory. You can see it here. Okay. So what are the functions also we can see it here. Okay. I'll show the laser pointer. So 1-1-1, 3-1. What are the 1-1-1? 1-O, olfactory, optic, oculomotor. So 3-O you can remember. Olfactory, smell, nose. Okay. Optic, eye. Okay, optal. Oculomotor, number 3. You can see it here. Eyeball movement. Trochlear, that is also for eyeball movement. Trigeminal, number 5. Where is the number 5 here? So the facial, you can see it here, number 5 here. Facial. That means not a facial now. So mainly for the sensation, okay, sensory and some motor movements of the face. Okay, because trigeminal has 3 branches. Okay, one is supplying the forehead, one is supplying the cheeks, one is supplying the mandible. Okay, mandible and maxilla also. Okay, so that is trigeminal. Number here, abduction. Okay, that is also for the eyeball movement. Number 7, facial muscles and acoustic. So that is why here I given number 8. It is, what is that? V for vestibulocochlear. Other name is acoustic. Okay, V is for vestibulocochlear, otherwise acoustic. Next is glossopharyngeal. Number 9. Number 10, vagus. You can see it here. Vagus, gag reflex, accessory nerves. Number 11, it is accessory nerves in the shoulders. Number 12, hypoglossal for the tongue movement. Okay, we'll see detailedly what are the functions of the each cranial nerve. First one is olfactory. Okay, that is smell. 1 second. So next first one is smell, olfactory. Second, optic, that is vision. Third one is oculomotor, and fourth one trochlear, and sixth one abduction. Three together, which is helpful for the eye movements. Next is trigeminal, facial sensation and jaw movements. Facial is taste. Anterior 2/3 of the tongue is supplied by that facial nerve, and also facial expressions. That's why when the patient gets a palsy, this facial nerve is affected, the facial expressions are affected. Next is acoustic, that is for hearing and balance. Next one is glossopharyngeal. Glossopharyngeal function is posterior 1/3 of the tongue, as well as the throat sensation and gag and swallow. And similarly, the vagus also is help for the gag and swallow reflex. Next is parasympathetic activity also, which is responsible for the vagus. Accessory, neck as well as back muscles. Okay, accessory muscles, and hypoglossal for the tongue movement. So these are the functions of the each cranial nerves. So you can remember these mnemonics so that easily you can remember the cranial nerves and their functions. And among these 12 cranial nerves, some are motor, some are sensory, some are mixed. That means some cranial nerves only have the sensory functions, and some only have the motor functions, only the movements. And some cranial nerves have the both the functions, sensory as well as the motor. So how can we remember that? You can go through this clock. So remember the clock so that easily you can remember. So whenever which is sensory, which is motor, you remember the clock. So this is the clock. So please listen carefully. 1, 2 are sensory. That means 1 or 2 people in this society, okay, or in your family, whatever which is your comfortable. In your family, only 1 or 2 people have the sense that we have to eat before 8 o'clock. Clear? உங்க வீட்டில் ரிமெம்பர் பண்ணிக்கோங்க, 1-2 பேர் தான் 8 மணிக்கு முன்னாடியே சாப்பிட்டுருவாங்க. These 1 or 2 and 8, these 3 only sensory cranial nerves, which means they have only sensory functions. Clear? Remember, 1 or 2 people have the sensation, sensor, then they eat before 8 o'clock. So this is sensation. Next is motor nerves. So which is near to the 1, 11 and 12. Similarly, which is near to the 2, 3 and 4. So this 11 and 12 and 3 and 4, they will come back to home before 6 o'clock after their work by the vehicle motor. So these 5 cranial nerves are comes under, 5 cranial nerves are comes under motor nerves. What are they? 11 and 12, 3 and 4. These 4 people reach the home before 6 o'clock. Okay, by motor, by bus. Bus is motor, no? So they will reach the home before 6 o'clock. They are motor cranial nerves. So which are mixed? So whichever it is missed, whichever we didn't discuss, so 10, 9, 7 and 5, they are mixed. Clear? If you remember the sensory and motor, so remaining things are mixed nerves. Clear? Once again, I explain. 1 or 2 people have the sense, so they will eat before 8 o'clock. They are sensory nerves, which is near to the 1, 11 and 12, which is near to the 2, 3 and 4. These 4 people reach the home by 6 o'clock by motor. That means by bus. So they are, what are they? They are motor nerves. So whichever which is missing, which is mixed nerves. Okay. So that's all about today's class. If you have any doubts, you can contact in the comment section. Okay. And also you can join the course so that we can go with the various topics in detail. Okay. These are some just like a trailer only. Okay. We will have the classes in a very detailed manner, videos and photos. Many things are we have attached in the course. So you can go through that if you join the course. Okay. So thank you all. Thank you so much. In next class, we will have the cranial nerves related questions. Thank you. Okay. Thank you all.